Video, we're just going to talk about a couple of common assistive devices that you may see in the camp or program setting. It is important to understand that when a child does have an assistive device, you want to make sure that you communicate with their parent or guardian about how often they use it, how they use it, and any support that they may need to use it, as well as if there's any cleaning requirements, just overall any assistance they need with that assistive device. This first slide is just a couple of examples of some mobility devices. So you may see a child with a wheelchair, a walker, crutches, another particular kind of crutches, which is loft-strand crutches. I don't believe there's a picture of those, but in the very top right, those are loft-strand crutches that are used when they're going to be more long-term as an assistive device. A gait trainer, which you can see in that top left middle picture. AFOs, which you can see in the top right middle picture, and prosthetic devices in the top left. So you may see these devices if a child has CP or cerebral palsy. You may see a gait trainer, spina bifida, spinal cord injuries, amputations. Essentially, the child is going to be having the least restrictive device that has the support that they need. So when you have a child that comes in with any of these devices, again, speak with their parent about how often they want you to use it and how, and also consider the environmental accessibility and as well as activity accessibility in the camp setting. And the AFO in the top right middle picture, that is an ankle foot orthosis, which is a brace that provides correction, support, or protection, and is often sort of an insert into that shoe and will be worn very frequently. For those specifics, again, you want to communicate with the parent to see what their child's support needs are. This slide has a couple of some assistive devices for assistive listening. An assistive listening device will help amplify sounds that you want to hear, especially when there's a lot of background noise. The two examples of devices you have in the pictures are a hearing aid and a cochlear implant. On the far left is a hearing aid, which will receive sound through a microphone, convert it into a digital signal, and then amplify it through a speaker into the ear. The middle picture is a cochlear implant, and there's also that diagram on the right, so you can see how it works a bit more as well. This will be surgically implanted to bypass damaged parts of the ear and to directly stimulate the auditory nerve. Some other devices you may see if someone has hearing loss or is hard of hearing is alerting devices may be relevant, which are devices that will connect to a doorbell, phone, alarm, or something else that typically makes noise and will instead emit a loud sound or a blinking light to let the person know that something is going on. So you may have seen this in day-to-day life where you can turn that on an iPhone where the flashlight blinks on and off when someone gets a text or call. That would be an example of an alerting device, but that can also be connected to a number of different devices. For visual devices, if someone has very impaired vision or is blind, they may use a white cane, which will help them sense their environment so that they can feel. This boy in the top left picture is able with that cane to feel the texture of the surface he's walking on, feel for any obstacles, and understand the space around him. We talked about having high contrast before, and this is another example of stairs with high contrast. In the bottom left picture, both of the bottom pictures are actually magnifying devices to assist with reading. And then it is important to consider when someone has a visual impairment or blindness that they will likely have difficulty manipulating small objects, which we talked about before, such as buttons on their clothes or opening lids and jars and that sort of thing. This slide shows some communication devices you may see. It's pretty common to have an iPad or some sort of device like in the top left picture that the child is able to communicate through by pushing the different buttons to express their needs and wants and just to communicate in general. So it's important if a child has that device that you're maximizing the use of it to really make sure that they're communicating as much as they want to. So that top left one is kind of a more advanced version, but you can also see visual boards, which are a little bit more simple, where it's more that bottom left picture where you're pointing to the different things that you're trying to communicate. A child may try to communicate through American Sign Language. If you don't understand that, they may have an interpreter or aide to help them communicate. And again, we talked about it before. If that's what you're doing to communicate, then you want to make sure that you're looking at who you're speaking to rather than the interpreter while you're communicating. Finally, these are just some assistive devices that can be used in day-to-day life. So you may see in the bottom left are universal cuffs that can be placed on a large variety of objects for a child that doesn't have the fine motor control or has difficulty grasping. So this helps them to be able to grasp different objects and to be able to manipulate them better to increase independence. So as you can see, with the marker, the child will be able to write more, paint, brush their teeth, eat. So really just increasing their independence in their self-care activities as well as leisure activities. You may see some adapted utensils in the top left picture. That is, you can get built up handles for different objects as well. So you can see it in utensils. You may see that as well in like on a toothbrush, on pencils, just building, again, those handles up so that they're easier to grasp and manipulate. And as well in that top left picture, there's an example of a bowl that is built up on one side that makes it easier when using utensils that you're not spilling out of it, and it just creates more control in the task of eating. And then finally, there's a large number of devices for dressing and grooming. So if a child has difficulty tying their shoes, they may just have Velcro straps. But again, this is not all inclusive. There is a huge number of assistive devices available. These are just some examples of what you might see, but in any case, you again want to communicate with the parent so that you're maximizing that child's independence in communication and functioning. Thank you for participating in the training. This has been the last video. So once you complete this one, you can go ahead and take the post-test, the second perceived competency survey, and then I would appreciate any feedback at all so that I can continue to modify and make this training as effective as possible.